One of the most common questions I get asked by visiting surgeons is how do we create a relatively bloodless field in endoscopic sinus surgery? A big part of this is making sure that we use non-specific alpha agonists. So we start by using adrenaline, 1 in 2,000, so 5 mils of 1 in 1,000 plus 5 mils of 1% ropivacaine. We soak these neuropatties or cottonoids in the solution. We use 10 of them, all 10 are soaked completely. And they're placed in the nose really the minute the patient is given their anesthesia. So as soon as the endotracheal tube or laryngeal mask is placed, we place these patties in an atraumatic way into the nose. We then do all the other setup, allowing as much time as possible. The first step is creating reverse Trendelenburg. It really creates a much more significant incline, getting to 15 to 20 degrees than one expects. This does not affect cerebral perfusion. Simple apps on the iPhone help you judge it when you're first starting. And then we make sure that our anaesthetist gives perioperative tranexamic acid. Tranexamic acid has really been shown now on multiple trials to have a large effect size when given perioperatively. It's given as a transfusion, usually 15 milligrams per kilogram. And then, of course, we're very familiar with TIVA, or total intravenous anesthesia. The most important part here is bradycardia, a use of propofol, remifentanil, metoprolol are used to help achieve this. It's not about achieving hypotension, but bradycardic conditions where the heart rate is between 50 and 65, and there's mean arterial pressure somewhere between 60 and 80. And then finally, the concept of avoiding mucosal stripping. Even in a pituitary approach like we're doing here, if you can maintain the mucosa over the area that you don't intend on dissecting further, it helps with hemostasis. The minute you strip the mucosa, as you can see here, you expose Haversian or bony channels that don't respond to pharmacotherapy. And then finally, in doing the approach as we're doing a posterior ethmoidectomy here through a superior meatus as part of pituitary, we're making sure that we don't strip in the approach. These 5 principles will make you a surgeon that continually operates in this bloodless field.